Hey everyone, today in this video we'll be looking at 3 tips to manage your knee pain or knee stiffness if you have knee osteoarthritis. To understand knee OA and the sources of pain better, you can check out my previous video from the link down here. So the first tip that I want you to try is to move your knee regularly. What I mean by this is I want you to move your knee into full flexion and full extension, meaning you bend your knee as much as possible and straighten your knee as much as possible, and try to do it regularly. So in a given hour, I want you to do it at least 10 times and repeat it 3 times. So in 1 hour, you are doing about 30 repetitions. And this exercise, I just want you to do it as much as you can tolerate. If there is a lot of pain, then don't continue. But if there is no pain and gives you some relief, then try this exercise out. One more benefit is that when you are waking up or sitting down for a long time and getting up, there will be stiffness. And before getting up, try this tip and you will feel much better when you stand up. The next tip I have for you is to strengthen your hip and your knee. So you want to strengthen up the hip and knee complex muscles, and simple exercises such as knee extensions and isometric holds in sitting or lying down, glute bridging in lying down, double leg bridging, or sit to stands. These are good exercises that will target both your hip and your knee muscles, and over time when it becomes stronger, the knee OA pain will reduce over time. Next is called the pacing of activity. So what pacing of activity means is that firstly, you want to conserve your energy to do the activities that you value, such as playing with your children or playing with your grandkids. And the next thing is setting up quotas to your current activities that are causing you pain. So kind of like limiting the activity at the start so that it does not trigger your pain to flare up. And how you want to start pacing is by considering these 3 factors. First is the time or duration that you're doing the activity. Second is like for walking will be the distance. Third is the number of repetitions. How exactly to use this pacing will be understanding these 3 things that I just mentioned, and you want to reflect on your daily activities for the last few days, and you want to observe for about 3 days to make it more sure. So for example, if walking for a duration of 30 minutes or maybe 100 meters increases your pain or causes it to flare up, then you want to reduce it a little, such as like 15 minutes of walking and 50 meters of walking, and then you take a break. So what this will do is before you hit the pain point, you actually take a rest break so that you conserve your energy and you reduce the chances of the pain being triggered or flaring up. And what you want to do over the next 1 or 2 weeks is to actually increase this distance or duration by about 10%, and you progress from there onwards. So what this does is actually give you a breakdown of your activities so that you do not perform your activity to the point where the pain happens, which then causes you to take a break for the next few days. Rather, by pacing your activity, you can do the activity but at a reduced state or graded down version, but continue doing it by remaining physically active over the next few days rather than just stopping and resting. So these are the 3 tips, and I hope it helps you to reduce your knee pain and knee stiffness in your knee osteoarthritis journey. Thank you.